Focused on mental health.
Mental health.
Mental health.
Mental health.
Mental health.
Mental health.
With the death toll here in the United States now above 160,000 as more than 1.5 million Americans recover. Dr. Jen, with those types of headlines, it's no wonder so many of us are struggling, not just physically, but psychologically. We even heard from former First Lady Michelle Obama saying that she is in a form of low-grade depression. Let's talk about mental health during this pandemic. Do we know where we stand?
On March 2020, we got the news of a disease named COVID-19. This turned out to be a global crisis and resulting of a global pandemic. Because of this situation, everyone started to quarantine.
Statewide order for people to stay at home.
Jobs were laid off, businesses were closing, and everything became virtual.
As the cases for COVID-19 rose, so did mental health issues for many people all over the world. It wasn't just hard to protect yourself from a deadly virus, but now we all had to face overwhelming, painful, and challenging circumstances that came alongside a pandemic.
What is mental health? Well, according to mentalhealth.gov, mental health is our emotional, psychological, and social well-being. It affects how we think, feel, and act.
But the increase in mental health issues wasn't just due to the pandemic. Long before COVID-19 hit, this issue was becoming a serious problem.
We've seen rates of anxiety and depression among young people increase throughout the pandemic. But it's important to recognize that our children were already struggling before COVID-19 arrived.
Even before the pandemic, mental disorders were twice as frequent among the poor as among the rich, and evidence indicates that depression is 1.5 to 2 times more prevalent among the low-income groups of populations. With the loss of jobs, incomes, and scarcity of food during the pandemic, mental health became 3 times as likely in these types of communities.
We know the impact of that has fallen particularly on people with lower household incomes who've been laid off in extremely large numbers.
The financial hardships didn't just reflect on the dinner table, but also in the mental health of caregivers. According to Sociology Today, 70% of adults serving as caregivers reported adverse symptoms related to mental health during the pandemic. But parents weren't the only ones feeling the financial hardships. Research shows that not only is financial and food insecurity top drivers of emotional distress among kids, it's even more for them when compared to their parents.
We know it's hit children particularly because the economic disruption has hit their parents. So we've seen recent research saying that almost 1 in 5 of parents with a child under 12 reports that children haven't had enough to eat because they haven't been able to make the food last the whole time.
Here at James Monroe High School, we asked students if the pandemic had affected their life in a positive or negative way.
It has affected me negatively.
Negative?
5 of 7 students said the pandemic had affected them in a negative way.
Definitely negative.
Not only did many of us have to struggle as individuals and students, but now we had to worry about making ends meet as well.
I think it's really clear how much there is to handle when you have a role as a student and then your role as yourself. And then when you're in high school, it's not just yourself, but you're a daughter, you're a sister, a son, a brother.
As both parents and children wondered how they were going to survive the pandemic, the stimulus checks were announced. The IRS issued 3 economic impact payments during the coronavirus pandemic for people who were eligible.
And I think it's going to provide immediate relief for millions of people that are going to be able to use it in a very constructive way and also grow the economy in the process.
You can see really that the data really follow federal government action. So we did a lot last spring in 2020, and there's a lot of evidence that really held hardship at bay. But last fall, we were waiting for the government to decide to do more, and we saw all these hardship numbers start to increase in November and December of 2020. And then they acted again at the end of December in the COVID relief bill, and you immediately see these hardship numbers fall. And then they acted again in the American Rescue Plan, and again, you see this sharp decline.
Not only did the stimulus help families financially but also mentally, anti-poverty programs including cash transfers can help to reduce the effects of depression and anxiety caused by job loss, unstable living conditions, and poor nutrition, according to a study by researchers at Harvard University and the Massachusetts Institute of Technology.